Hello, and welcome to Keynote. I'm your host, Elizabeth Moore. Earlier this month, we talked with Dr. Renee Williams about the screening no one likes to talk about, the colonoscopy. In this month's Keynote, Dr. Williams explains what it means if growths called polyps are found during your colonoscopy and how they can be treated.
Essentially speaking, when we do colonoscopies, we look for precancerous lesions called polyps, and they can be removed. In essence, by removing these polyps, we prevent people from developing cancer.
That's what I wanted to ask you about. What exactly are polyps?
The way I explain to my patients, it's imagining a growth in the colon, and it's an abnormal growth of cells. And there are different types. And over time, and it takes years, it doesn't happen overnight, they can turn into cancer. So imagine something like a boulder or a tree. And it's just a growth that we see, and it's abnormal cells.
Mm-hmm.
And depending on the type of polyp determines whether or not you may become cancer.
So when polyps are found during a routine colonoscopy, they need to be removed.
In most cases, yes. There are certain types that are not dangerous. They are on the left side, they're small and tiny, and normally we can tell what they look like. But in generally, most gastroenterologists, I think, would remove all polyps.
And what happens if you do find polyps that are cancerous?
So if it depends. So at the time of the procedure, we can tell if something looks like a cancer or not. In that case, the physician will probably speak to you after the procedure to say, we saw something, we took some samples, we think it's cancerous, and here are the next steps. Because that's a very scary thing to tell someone, right? If it's not cancerous, but a precancerous lesion, you'll get a phone call. It does take sometimes 2 to 4 days for the results to come back. You'll get a phone call from the physician or some representative from the office to say, hey, it was benign. It could have become cancer. But then you come back in 3 years, 5 years, 10 years, depending. Something very large, we may have a 3-year return period. So I will tell patients it wasn't cancer, but it could become cancer in a couple of years from now. Because it takes about 10 years for something to go from a polyp to a cancer, 10 to 15. But there are certain polyps that become cancer a lot quicker. So depending on the type, determines when you come back. Colon cancer specifically is preventable, it's treatable, and it's beatable.
For more information on what you heard today, please check our show notes. And remember, subscribe to Health is the Key wherever you get your podcasts. This podcast and its content are presented solely for general informational and entertainment purposes. The information and opinions provided on this podcast are not intended as legal or medical advice and do not constitute or serve as a substitute for professional medical or psychological treatment, diagnosis, therapy, or other types of professional intervention.